Assalamu alaikum. The second part of the discussion of the GIT history, constipation history. So, constipation history, the scenario was that 5 years old child developed constipation since last 3 years and last 6 months swelling. So, what may be our differential diagnosis from this scenario? We can first consider because before taking the history station, we have some time, and there we can make our differential diagnosis. So it may be functional constipation. It may this functional constipation also have some factor that's taking less fiber, less fluid, any emotional trauma that may cause this soiling problem, and there may be any medication can and for the reason behind the functional abdominal pain, there may be family history is present, and food habit is important here. And after functional constipation, second differential diagnosis can be hypothyroidism. It can due to celiac disease, cystic fibrosis, and spina bifida. So from the history, just like other introduction, rapport formation. So, and history we have to cover two types of question. One is the direct question and open end question, and another we also have the question just like the descriptive one. Would you please describe his bowel habit for me? Okay. And what is the direct question? Is it painful or not? It is a direct question. So what history can we, that we can ask in the constipation, that how frequently he open his bowel, is it painful or not, do you notice any kind of blood along with it, what is the shape of this stool. At the end of our discussion, I will show you the chart so that you can easily recognize it. And any swelling do you notice, and how frequently this swelling occur? Do you notice any holding behavior and any factor that increase it, and how is it relieved? And from when she started the potty training and how much time she spent there, and then it's a constipation for last 3 years. So what did you have done for him? And after that, this is the presenting complaint, and to important history including this presenting illness, is there any tummy pain present or not, any throwing up present or not? Okay. And then the history for the constitutional history, is there any weight, do you have any concern regarding his weight? Weight gain may present in hypothyroidism, and any kind of fever, because any kind of febrile illness may induce constipation. And how was the activity and the sleeping, and then ask the systemic review. And in the systemic review, it's important that any kind of weakness, any part of the body, any swelling on the back, because this is the for the spina bifida we are excluding, and for respiratory, any cough. Why it is important? As cystic fibrosis is one of our differential diagnosis. And P is very much important, because constipation is one of the risk factor for UTI. So what do you have any concern? And any swelling on the neck and cold intolerance, this is for hypothyroidism. And then pregnancy history, and then past medical history that we have discussed, that past medical history we know about, what we have to ask. And that feeding history is very important here. And then developmental history, and the history for the allergy to any food or medication present or not, and then the family history and the social history, and the school history, any bullying, because soiling is present, does school nerve inform of this condition or not, and then impact of the condition. and then presentation. In the presentation, the scenario that Dr. Arman did, so we can summarize in this way that today I see Mrs. Oliver with Millie, 9 years of old. Millie has constipation for last 3 years and swelling for 6 months. And there is occasional tummy pain is present, and there is no history. There is no history suggestive of, and this constipation is associated with occasional tummy pain and swelling, and there is history of unbalanced diet, less intake of fluid, and recently due to some some family reason, her father goes another city, and this impact very much on this child, and family history of constipation is present, and the child is facing bullying in school due to this issue. So what maybe we have discussed about what could be the differential diagnosis, and now the management. In the management for constipation is in investigation, what is your management plan? Management plan, I will take the focus history, general examination, vital sign, para-abdominal examination, perianal examination, examination of the spine, and lower limb examination. And investigation, it is not routinely required, but when needed we can do the thyroid function test, celiac screening, sweat test, stool dipstick, urine examination and analysis, full blood count, and radiological imaging not indicated for idiopathic constipation, and if pathological causes excluded, so and no red flag sign, so we can call it idiopathic constipation. And abdominal X-ray, if the history is suspicious and examination is difficult. This all about the investigation, and now the management. So we will per abdomen, we will look for this impaction present or not. If there is impaction, short term management, so for impaction, first of all, initial is oral Movicol for 7 days. If not working, so stimulate Sina, and review the child after 1 week. And if it is failed, then we can use rectal disimpaction, and as it we can use sodium citrate microenema. And if it failed, then manual evacuation under general anesthesia, but we have to inform gastroenterologist, pediatric gastroenterologist. And this is the short term management. And long term management is multidisciplinary team, and here we will involve the pediatrician, and then involve the educate the parents, and maintain of the symptoms diary, diet and lifestyle modification, and medication. And medication, for the maintenance medication, Movicol or Sina if Movicol is not working, and Sina we can use for a short period of time. An alternative of Movicol is lactulose, but if the child is less than 6 months, so we can prescribe glycine suppository and treatment of the underlying cause. And then we can involve the school nurse, community nurse, advice about medication and the compliance. And in the multidisciplinary team, our consultant, gastroenterologist if indicated, and social service, social nurse, and psychological support if needed. So one of the recall question was that when we will refer for gastroenterologist. Refer for gastroenterologist when unsuccessful disimpaction, soiling and abdominal pain continues despite the treatment, age less than 1 year with fecal impaction and no response to the treatment. And another recalls question was indication of okay, during examination I forgot one thing about the thyroid examination, and indication of rectal biopsy. So history of delayed passage of meconium, constipation since the neonatal period, failure to thrive, family history of husband, history of abdominal distension and vomiting. And some medical college has medical hospital has constipation clinic. If needed, if there is a clinic, so we can refer. And then red flag sign for constipation according to guideline: early onset of constipation, failure in the neonatal period, failure to thrive, is there any neurogenic bowel present, urinary incontinence, Hirschsprung disease, passage of blood unless due to fecal fissure, acute onset of constipation, vomiting, enterolip displaced anus, anal stenosis, protein intolerance, history of sexual, physical or emotional abuse. And one recall question is, what is movicol? Dose of movicol. So movicol, and differentiate between the functional and the organic constipation. So the differentiation between this functional and the organic constipation: history of delayed passage of meconium, failure to thrive, present in case of organic constipation. And functional constipation usually actually a late onset, and fecal incontinence is present here, and there is withdrawal behavior is present in case of functional constipation. And in case of the parectal examination, in the rectum there will be stool in case of functional constipation. And then what is movicol? Movicol is macrogol, laxative 3350, and how we can prepare it: mixing water 240 ml. Dose day 1 2 sachet, 2 and 3 4, 4 and 5 6 sachet, and 6 and 7 8. And these all about the recalls of constipation. Thank you.